To end this morning and before stepping into session 2 this afternoon, we are going to have some conclusions with Emmanuelle Soubeyran. You are Deputy Director General for Food at the French Ministry of Agriculture and Food. And I give you the floor now, Mrs. Soubeyran. Thank you.
So good morning everyone. I'm very pleased and honored to speak here today during your conference as a representative of the Ministry of Agriculture and Food, and also as French Chief Veterinary Officer. So the question I would like to raise as the closer of this morning is what can the One Health concept provide to a risk manager, and what practical lessons should we learn from the COVID crisis in this area? And this morning I will focus on monitoring and control, which is the subject of the conference this morning. But of course, as the previous speakers said, I don't forget prevention and preparedness, which is crucial. Of course, for a policymaker and risk management, surveillance and control tools are essential for the early detection, identification, and management of animal disease, some of which may be zoonotic, and you already spoke about that. So if you can put next slide, please. Next slide. I will not go into the definition, of course, of One Health that Eric Lelouch presented in its introduction. It is a concept that emerged 20 years ago, but whose origin can be found in very old writings. So obvious is the concept of considering the link between animal health, human health, and the environment. For instance, the writing of Vitruve, which is an architect living during the 1st century before Jesus Christ, are very demonstrative of this very obvious concept. What I just want to highlight in the revival of the One Health concept, it is the necessary transdisciplinarity. We need to put together veterinarians, human doctors, epidemiologists, ecologists, law specialists, sociologists, economists, and the importance of cooperation between all actors, public, private, like in VPH Hub in Lyon. Of course, also the importance of managing issues at international level. As we saw during the COVID crisis, microorganisms have no borders. And what has changed with the COVID crisis is that the environmental component has been better taken into account in this approach. And next slide. Therefore, we believe that new paradigm is needed to tackle more complex health problems. Next slide. The COVID issue led us, no, you can say, oh, it's okay, it's the same. Led us to question our organization. We asked ourselves the question, beyond the concept, how can this approach be better taken into account in practice in an organization like ours? In the field of animal health, awareness and action have been taken for several years by the Ministry of Agriculture, which is fully mobilized and leads all the players concerned to reduce, for example, the use of antibiotics in livestock farming, to guarantee healthy and safe food, and to fight against epizootics, including in collaboration with human health players when it comes to zoonosis or food poisoning. Furthermore, the preservation of the environment, the third component of the One Health concept, is at the heart of the ministry concerns, which is fully committed to the agroecological transition to our agriculture, in particular within the framework of the Green Pact for Europe. The Directorate General for Food, where I belong, is responsible for food safety and quality at all levels of the food chain, as well as the health and protection of animals, and plans in relation to the various actors concerned. So One Health is something that we practice every day and for a long time. When, for example, we are monitoring food safety, when we are fighting against avian influenza, when we are preparing on prevention against African swine fever, when we are fighting against brucellosis, when we are building public policies on antibiotics resistance, which necessarily links human health, animal health, environmental health. But nevertheless, the Director General, Bruno Ferreira, who you can see his picture on the slide, wished to re-examine the organization of our directorate a year ago in a One Health perspective in order to learn the lesson from this crisis. Indeed, in a rapidly changing environment, globalization, climate change, new pathogen, society expectation, growth of population, and so on, it is imperative, it is very important for any structure to re-examine its organization, its functioning, and the priorities of its team. And this is what the Directorate General for Food has been doing for a year as part of the development of a new strategic plan for 2021-2023. This strategic plan, which was constructed with also the decentralized services, placed the One Health approach at the heart of its action by promoting transversality and transdisciplinarity within our organization and promoted integration of risk assessment, surveillance, risk management. I can give you some example of that. There's a creation of an office for the control of risk affecting food safety, including chemical risk, which were previously managed separately. Another example, we created a subdirectorate for Europe, international affairs, and integrated risk management to provide a transversal link between risk assessment conducted by the assessment agency, the ANSES for us, and the state's action in deploying public strategy and control in the field and in defining European and international position in negotiations. This reorganization has been accompanied by training in new management and new leadership techniques based on collective intelligence. And so we think that One Health is a concept that requires to be constantly vigilant in thinking across disciplines and not in silo. And of course, this is what we've done in our ministry, in our directorate, but this approach must be developed also between ministries. It has been said before, and we are working in this conjunction with the Ministry of Health, Environment, Consumption, but also Foreign Affairs and other ministries. So next slide. Surveillance, next slide, is crucial in the management of both animal and human diseases. Because, as I said, and you said all, it allows for rapid detection and therefore rapid response. The question is, how can we be more efficient in surveillance? Next slide. How can a One Health approach help us for better collaboration, reinforcement of surveillance system, better coordination, better governance? Next slide. I will explain very shortly what we did in France, because I understand that it will be explained in more details later on. But next slide. In France, we have launched 3 platforms in the field of animal health, plant health, and food safety. So I can briefly describe the animal health platform, which is called the National Platform for Epidemiosurveillance in Animal Health. It's a tool for eco-safety monitoring in the field of animal health. It plays the early warning chain concerning priority health risk collectively decided, which is very important, when necessary. This platform must implement disease surveillance protocol and jointly analyze the health data reported by various health monitoring networks in mainland France and in the overseas territories, in conjunction with OIE, FAO, and WHO. And the partners of the platform are public partners, Ministry of Agriculture, Evaluation Agency, ANSES, Santé Publique France, with the Agency for Public Health, Human Health, Research Institute, INRAE, CIRAD, and also professional farmers organization, hunters organization, veterinarian organization. So this I described very briefly the platform for animal health. But we have 3 platforms, and these 3 platforms are constructed in a One Health approach because it relies on collaboration between public and private partners at different levels of responsibility: professional, assessment agency, research institute, governmental department. Because it extends its work on international signal. Next slide. What we want to do now is to move forward. Next slide, please. To move forward 2 directions. To improve coordination between surveillance systems towards more transversality. To develop a collective culture, to identify health issues that require development of integrated surveillance approach, to share the experience, skills, data, technology, and that's why we need this inter-platform also and coordination. And also, the other direction is to improve coordination with other existing systems in other countries. Next slide. And in the framework of the French presidency of the EU Council, we are organizing the 22 of March a conference to present these platforms and also to present other existing systems in Europe and to have discussion at with European experts. Next slide. The next example I would like to discuss focus on official surveillance and control of the food chain. It is also based on principles I had previously developed: integration of different disciplines and science, development of a coordination interface to link sectors to each other. And this is a current objective of our directorate, to develop methodology for more integrated risk analysis in order to state priorities in our surveillance and control activities, which are clearly proportionate to the risk. Because of course, we need to have to focus on what is more important. And to achieve this objective, we consider risk assessment from ANSES, result for national surveillance and control plans, result from biosurveillance, human health monitoring, as well as data gathered from events and surveillance, for instance, obtained from the platform we just spoke before. And this information from different disciplines and sectors should enter the integrated risk analysis for stating proportionate decision. Next slide. So the One Health approach is a way to reach our objective more efficiently in an innovative manner, focusing on interaction and collaboration to bring together surveillance systems for better detection. When it is considered that there is an adding value to collaborate between sectors and disciplines for example, the data I have through my surveillance system could fruitfully serve another surveillance system for earlier detection. Then we need One Health approach. And this type of collaboration should be decided on a case-by-case basis, depending on the needs. And One Health approach needs time because some sectors are not used to work together, have different cultures or referentials. And I think that step by step, locally, regionally, and internationally, the approach should be used more and more. If you can stop the slides, I would like to say a few words and finish my presentation. I would like to conclude by referring to the article that was published in Le Monde on the 10th November of 2020. It is not a scientific article, but it was written by a scientific newspaper. But it was written by a group of researchers, doctors, and veterinarians who wrote this, and I think it is very important: anticipate, monitor, act, communicate, react, and in times of peace, co-construct a resilient social ecosystem that does not favor the emergence and prevents the spread of pathogens. This must now become a shared objective of renewal of health management on the scale of the territory, the country, and the entire planet. The high-level panel of experts, OLEP, of the WHO, OIE, FAO, and United Nations Environment Programme, whose objective is to inform organizations and governments on the state of knowledge and the action to be taken, will help us in this direction. And so will the PREZOD, Preventing Zoonotic Disease Emergent Initiative, which aims to provide a framework of coordination, research projects, monitoring network, and operational projects, and for sharing knowledge. So I think we have all together a lot of work to do, and that together we can achieve it and do it. So this was my last words.
Thank you very much. Thank you very much, Emmanuelle Soubeyran, for this view, your view on One Health, and a bit of strategy from French Ministry of Agriculture and Food, especially in your DG for food. Thanks a lot.